Welcome to Healing at the Speed of Light. Every week we discuss how laser therapy is changing healthcare and how you can benefit. Now, here is your host and founder of Laser Therapy Institute, Dr. Jason Roundtree.
Hello again, and welcome back to Healing at the Speed of Light, your weekly laser therapy podcast. I'm your host, Dr. Jason Roundtree. Today we're going to be talking about hypothyroidism and the way the thyroid functions, and specifically we'll be talking about chronic autoimmune thyroiditis. So to break that down, we're talking about the thyroid not working as well as it should. It is hypofunctional. That means it is not working well enough. And with chronic autoimmune thyroiditis, we're talking about a long-term disease progress driven by immune system dysfunction that attacks the thyroid and inflames it. So, first thing I want you to have a picture of is how the thyroid works. And we'll try and keep this as non-nerdy as possible. But there's a few words that I'd like to mention here because you're going to hear them if you're dealing with a thyroid problem. You're going to encounter these terms. You're going to see this on your blood work. Your doctor's going to talk to you about this. And it's a fairly complex idea. So I'm going to try and present it to you in a way that's pretty straightforward and easy to understand. It'll give you an idea on what it means when your doctor goes over your blood work with you or prescribes you a medication. So with a normal thyroid function, you have a couple of other glands that are associated with the thyroid too. So the hypothalamus actually produces the first hormone that has an effect on the total thyroid production. The hypothalamus produces TRH, or thyrotrophin releasing hormone, and that in turn stimulates the pituitary gland. The pituitary gland then produces thyroid stimulating hormone, or TSH. Now that's one you'll definitely see on your blood tests. You'll see TSH in pretty much even just your regular annual blood work. So that means thyroid stimulating hormone. Again, it's produced in the pituitary. Now this thyroid stimulating hormone will then go on and tell the thyroid to make its hormone production. And the thyroid gland will use iodine to create T4, T3, and calcitonin. Now, again, T4 is one you'll see on even just your annual blood work. So you usually see like TSH and T4. Those are the standard tests that can be done. A lot of times, if you get somebody who really knows their stuff and does some advanced testing for the thyroid, if they suspect a thyroid problem, you'll see TSH, T3, T4, and then sometimes a couple of others too. But that's kind of the cascade here, right? As you start off with the hypothalamus producing TRH, TRH makes the pituitary produce TSH, TSH makes the thyroid use up iodine to produce T4 and T3, and then calcitonin. Now, the more T4 and T3 you have, the less the body is able to produce T4 and TSH. So the higher your T4 levels are, the less TSH you make. The higher your TSH levels are, the more they can push that T4 and T3 production. So it's a process that has some feedback. The more T4 and T3 you have, the less the body's going to try and make your thyroid create thyroid hormones. Now, T4 is kind of a supply source for T3. So it is actually converted kind of as needed in the tissues by deiodinase. Don't worry about the terms. You don't have to remember that one. But that makes it into the more active form of T3 so that it can then act on the cells of the body. And this is a body-wide effect. So T3 actually binds to cellular receptors, and that stimulates improved basal metabolic rate, how fast your body produces and uses energy. It also has a lot to do with your protein and carbohydrate catabolism or breakdown. It has a lot to do with brain development and then cardiac output, heart rate, even breathing rate, ventilation rate. So we've started with this cascade process, right? It was TRH, which helps produce TSH. That makes T4 and T3 production happen. T4 floats around the body until it's really needed, at which point it's converted by deiodinase to T3. T3 then acts on all your cellular processes to speed them up to the right level. So if you're thinking about this, the proper balance of T3 is dependent on all these other factors, but T3 is really the one that drives a lot of the daily activities you go through and a lot of the processes that kind of happen in the background. If you have a problem with T3 production or the amounts that are on hand overall, you can probably see right off the bat how that's going to affect things like weight gain, fatigue levels, the way you sleep, how well the brain works, how well you utilize the food you take in even. All of that is very, very much affected by the way the thyroid works. So, given all that, we're going to be talking about the thyroid not working well enough, hypothyroidism, and specifically chronic autoimmune thyroiditis. So, what is chronic autoimmune thyroiditis? Well, like we said at the top, it's an autoimmune disease. It's chronic inflammation that targets the thyroid tissues, causes a cellular destruction process of the thyroid, and decreases the production of T4 and T3. Now, when your body senses that, it ups the production of TSH, the thyroid stimulating hormone we talked about, in an effort to try and get the thyroid to make more of the T4 and T3. But once, and this has gone on long enough, the thyroid doesn't have enough healthy tissue left to make enough T4 and T3. So on your blood work, what you'll see is the TSH will be very high, T4 will be very low. With me so far? All right. Now, we're going to be talking in depth today about what this is and how to fix it. We've already kind of gone through the way the body's supposed to work. We're going to talk about the current treatment next, because again, this is an autoimmune process that affects your T3 and T4 levels. That's the real problem. We don't really care about trying to bring down your TSH level. That's more of just an indicator that there's a problem there. But the T3 and T4 levels are the ones that really affect the way your body runs. So right now, the best treatment we have for this is to supplement your body's T4. That's by using a medication called levothyroxine. That's pretty much the common thing to do. And we basically let the thyroid burn itself out. You just allow that inflammatory process to continue until the thyroid is pretty much non-functional. And you just supplement the person with this levothyroxine drug. That allows you to maintain the body's metabolic rates. But, I mean, it's not ideal because that does change over time. And so you have to adjust the patient's levothyroxine dosage. If somebody forgets to take it for a long time, or they run out, or they accidentally take double, you have really big metabolic effects that can really affect a person. So, I'm going to pull a quote from our study here today, and this study is titled Low-Level Laser Therapy in Chronic Autoimmune Thyroiditis, a pilot study. It was published in 2010 in Lasers in Surgery and Medicine. And to quote the study, they say, an ideal therapy would be efficient in reestablishing immunological tolerance and regenerating damaged thyroid tissue so that the patient could regain normal thyroid function and cease using levothyroxine. Basically, we would want to bring down the inflammation and we want to regenerate the thyroid tissue to get the person back to normal. Just kind of put this disease in reverse, right? Well, that's obviously not what we're doing right now. We don't have a good way to put the inflammatory process in check. And the oral steroids and things like that don't really work for that. That's why currently the only thing we can do is use levothyroxine to kind of replace your body's T4 and just kind of wait for this process to do its thing and just let that fire burn. I'm going to go on to quote from the study again here, though, because they say that laser therapy is uniquely suited to address thyroid conditions. For one thing, we've seen it be effective in treating autoimmune disorders like rheumatoid arthritis, and also we've seen it facilitate the regeneration of various tissues. So, to quote from the study again here, specifically for the thyroid, well, for one thing, it's superficial, and the laser can easily access it transcutaneously. That means through the skin. Number 2, the procedure is non-invasive and painless. Number 3, it is low risk because it does not involve the use of ionizing radiation, like X-rays or any other kind of radiation. And number 4, the procedure is low cost. This doesn't really have a really big, steep drug use associated with it. And the laser machines themselves might be a bit expensive, but to have a laser treatment done, really in the grand scheme of things, is fairly cheap. So this study took 15 patients with chronic autoimmune thyroiditis. They'd had it for about 4.5 years on average, and they were all taking levothyroxine. The researchers did a diagnostic ultrasound before and 30 days after the laser therapy was done to measure the volume of the thyroid and really see what it looks like. They also did labs. They did blood work before they started laser, and also at the 1 month, 2 month, 3 month, and 9 month marks. This is a pretty long-term study. Now, again, these patients were all on levothyroxine. So they maintained them on that same dose through the month of doing laser therapy, and then they took them off their levothyroxine. As they needed to, as they did more blood work, they gradually reintroduced levothyroxine until all the hormone levels looked balanced out. They did a total of 10 laser treatments, twice a week for 5 weeks. They used continuous wave settings, very, very low power, average of 70 joules per treatment. Here's what they saw. They saw there was a reduced need for levothyroxine in 100% of their patients. All the patients needed less medication, and almost half of them needed no levothyroxine anymore at the 9-month follow-up. So not only did everyone experience an improvement in the way their body was working and were able to reduce the amount of thyroid medication, but half the people never even had to go back on it after laser was done. As far as the follow-up measurements with the ultrasound, the thyroid volume was normalized in about 43% of the patients. There were no nodules that developed in the tissues, and the tissues had improved consistency and blood supply, which is a couple of things that you see in a chronic autoimmune thyroiditis kind of case. They also saw a reduction in the antibody counts. Now, this is one I haven't mentioned yet, but in autoimmune thyroiditis, you'll see an elevation of 2 other blood work markers. That is thyroglobulin antibodies and thyroid peroxidase antibodies. Those are 2 markers that tell us there's definitely a lot of inflammation going on that's affecting the thyroid. These researchers saw a good reduction in both of those antibodies from comparing before laser to that 9-month mark. Not that everything was perfect, but they saw a good reduction, meaning that we have less inflammation in the thyroid, there's less destruction going on, and it's working better. Because a lot of the people didn't even have to go back on their medication. If you follow laser therapy and research, or if you have a thyroid condition and you've looked into this before, this is what's called the Brazil study, because it's a fairly well-known study that showed some really surprisingly good effects for laser therapy. A couple of takeaways for you. One is that this was a very, very low dose treatment. Compared to many orthopedic conditions that are treated with laser, this was very, very low dose. So the way that you treat the thyroid really has a big impact on what your results are. Number 2 takeaway is that this took a while to show up. It didn't take a lot of treatments, but it took a longer period of time to see some of these improvements. Number 3 is that everyone saw improvements. Now, you can't ever guarantee results when it comes to medical care. However, when we see some consistently good results, some good improvements on a study like this, that typically does translate pretty well to clinical results. Here's your last one, last takeaway. This is not being done here in the U.S. This is really not common to see at all with practitioners that can do laser. For one thing, it's not well known to be that effective here in the U.S. for whatever reason, and there's a lot of practitioners that are very hesitant to laser over the thyroid, and rightly so. There's a few different things that you have to be very aware of when you get into that. So, if you are looking for someone who can do this, you're going to need to find a laser therapy expert. And that's where I'm going to plug our sponsor, Laser Therapy Institute, because Laser Therapy Institute's protocols have built in there how to do these treatments. Now, this is not right for everyone. This is not even something that that everybody should be looking into. However, if you're interested, you want to talk to an expert for sure. So you can hop on our website, lasertherapyinstitute.org. You can go to the provider locator map and see if there's someone near you, or if you'd like, you can email us and get some advice as well. Thanks very much for joining us this week. I hope you were able to learn something about the way the thyroid works. Hope you're able to have some more knowledge going into even just your annual checkup. Know what that T4 means, know what TSH is. And if you need some help with a thyroid condition, make sure you reach out and let us know.
Subscribe to this weekly podcast for more great information. Find a certified laser therapy clinic near you at lasertherapyinstitute.org. If you're a healthcare provider, check out our practitioner-focused Laser Therapy Institute podcast. Thanks for listening.